Thank you, Shalini, Donald, Professor Jha, distinguished guests, ladies and gentlemen, good morning. It gives me immense pleasure this morning to be able to participate in this ceremony that marks the launching of a very important platform, the HospitalAdvisor. And I congratulate Shalini for this initiative, and thank you so much for sharing with us your experience and also this initiative of coming about, getting on with this website and all your experience and also some history related to it. And I'm also glad to see many of you, all the great minds here this morning, coming together, sharing your experience and also thoughts about how best to improve healthcare and also patient outcomes. I think quality of care and also patient safety, as Shalini has earlier alluded to, are very dear to our hearts. In Hong Kong, under a dual-track healthcare system, we've always been encouraging both the public as well as the private sectors to improve and also to innovate so as to provide efficient and also quality healthcare to the general public. With the rising public expectation on the quality of healthcare services, patient experience, and I'm sure you agree with me, is an important aspect that has to be taken into consideration in account of our service delivery. In our public sector, notably the Hospital Authority conducts patient experience and also satisfaction surveys to gauge users' views on the healthcare services they receive. Of course, this is more a formal way of collecting feedback, but there are also other informal ways of collecting feedback in the Hospital Authority. The day-to-day communication that patient with doctors, nurses, and other healthcare professionals, and many other occasions. For example, all the thank you cards that is displayed in the hospital corridor, and perhaps complaint letters that came in. So all these are feedback, from our patients. And just to cite an example, in a survey conducted in 2014, I think over 86% of respondents rated the overall inpatient experience in public hospitals as good. The Hospital Authority also set up community focus groups comprising of public members and also community members with whom the hospital management discussed specific public healthcare issues on a bi-monthly basis. Of course, I applaud the good job of the Hospital Authority that has been doing and also looking forward to its continuous engagement of the public to listen to their feedback, views, needs, and maybe complaints. And as regard to the private sector, Shalini has earlier on alluded to, is very different. She didn't understand why there is vast difference. There are now 11 private hospitals as well as many private medical centers and clinics providing quality healthcare for those who can and are willing to pay for services with personalized choices. And with the changing landscape of the private sector and also the technological advancement, we note that the current regulatory regime, which is limited to a narrow set of facilities drawn up decades ago, the law is very, very old, and is unable to meet present-day needs. This calls for a root and branch review of the regulatory regime for the private healthcare facilities, of course, include private hospitals in Hong Kong. And I'm pleased to report to you that the government have completed a thorough public consultation on this regard and released the consultation report last month. Our proposals for a revamp of the regulatory regime were warmly supported by the community, and we are working in full stream to prepare for the relevant legislative exercise. We are very eager to work with all of you to modernize our regulatory regime and also to promote improvements in quality and also patient experience. Hong Kong prides itself as one of the leading cities in the region in terms of our healthcare achievement. But that said, there is no room for complacency. With our efforts in both the public and private sectors, we are confident that the quality services and also pleasant patient experience will continue to provide to our people. Before closing, I would like to thank Shalini, Donald, and all the organizers again in hosting this very meaningful event. By the way, I really like the Chinese translation of HospitalAdvisor. That means medical wisdom, and I think that tells a lot about HospitalAdvisor. Congratulations once again, and to all of you, I hope you have a very fruitful discussion. Thank you.